concerned should patients be that they will lose their insurance coverage?
I would say the concern is real.
Tonight, health industry experts are weighing in on ongoing contract battles between local health systems and employers. Ohio State is in negotiations with Anthem Insurance, and Mount Carmel is negotiating with Aetna. This is all unfolding just one day before the end of the open enrollment period. Thank you for joining us for 10 TV News at 5. I'm Yolanda Harris.
And I'm Angela Ann. So both have until the end of the year to reach an agreement, or some patients will no longer be covered. 10 TV's Carla Rogner has been digging into this battle for weeks now, getting you and your family answers on how this may affect your coverage.
I reached out to Anthem and Aetna today, but there is no update in those contract negotiations. In the meantime, we're hearing from patients who've taken steps to switch insurance and others who are anxious because they don't have that option. It's the first time contract negotiations between Ohio State and Anthem have reached this stage. Sean Stack is the National Director of Policy at Hospital Financial Management Association. He says it's a sign of the times.
Is this something you expect to hear more of?
I think whenever you see a hospital such as Wexner Medical Center, who has not, to my knowledge, and I worked there for 10 years, close to 10 years, who has not terminated a contract of this size since I've known them, I think that's an indication that things are not in a good place with payer-provider relationships.
Right now, insurance companies and health systems are in similar battles across the country. Just this week, Cleveland Clinic reached a deal with Anthem.
Is there a reason that things are kind of seeming to come to a head right now at so many different places at once? Is something different this year?
I honestly would say its operating margins are at an all-time low for hospitals. The profitability is very slim.
The contract negotiation process is not regulated by the State Department of Insurance. John Palmer at the Ohio Hospital Association says it's important patients look into options that will be covered in their plan if these parties cannot reach a deal.
It is important that if there is some disruption, to know that you're able to find a care that will help you through this period.
Patients in active care at the hospitals may qualify for continuity of care, but what's covered under that stipulation depends on the plan and situation. The experts call this a worst-case scenario for patients who get insurance through their employer. For patients on Medicare Advantage plans, there's still 1 day left in the open enrollment period to find a new plan that includes their providers in network. Reporting in Columbus, Carla Rogner, 10 TV News.